If you don't stop the so-called antidepressant, the patient will not get better when they have mixed states. And in fact, what's being missed is that they have mixed states. They don't have quote unquote depression or treatment-resistant depression. And what they really need is a dopamine blocker or a mood stabilizer. Now, sometimes the patients will get dopamine blockers or even mood stabilizers added to the antidepressant, but that doesn't work because the so-called antidepressant is worsening the mixed state and counteracting the benefit of the dopamine blocker or the mood stabilizer. The antidepressant has to be stopped. If you don't stop the so-called antidepressant, the patient will not get better when they have mixed states. Then they do respond to dopamine blockers and mood stabilizers. In fact, the SRI is part of the problem, in my view, and the so-called antidepressant needs to be stopped, and then the antipsychotic or dopamine blocker can be used for the mixed state, along with often a mood stabilizer is a good idea as a long-term for long-term prevention, but also sometimes helps for short-term symptoms. So that's my general view of mixed states, that they're common and that they are very important diagnostically and therapeutically. Diagnostically, because in a way, they disprove the DSM system, and therapeutically, because the treatment is so much worse with the most commonly given agents, the antidepressants, and we can really make patients with different classes used instead, like the dopamine blockers and mood stabilizers.